Life lets you relearn things na alam mo na noon pa. Hi guys, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life. Oh, sorry. May patient kasi ako the other day. We were talking about her annual physical examination. For the purpose of confidentiality, hindi ko naman babanggitin kung sino siya, but the topic was about her lifestyle choices. She has a very active lifestyle. She's a PE teacher, meron siyang very enthusiastic personality, kaya niyang mag-perform beyond her age, around I think 60 na siya, or 50. I'm not quite certain kung ano yung exact age niya, but she is physically active. That was during the physical examination. We did some battery of tests. Na-mention natin na meron, nakita natin sa test na meron na siyang abnormal ECG tracing. So usually it's a AV block. So an AV block is usually there is a delay on the conduction, specifically sa atrioventricular area or the bundle branch block of may bundle block, AV block mismo. So either magkaroon ka ng delay na conduction, it can be problematic or it can be asymptomatic. Pero for her case, it's asymptomatic, walang symptoms at all. Now, I would have discussed with the patient kung ano yung findings overall naman on her health. Unremarkable, wala ko nakikitang problem other than the ECG tracing. So I suggest na we repeat the tracing after a month to check. But during those times, kailangan ko kasing i-reiterate sa kanya, we have to try to lessen any strenuous activity that might aggravate yung condition niya. Na bakit mahalaga yun? Because it might, accelerate or increase the risk of developing other problems in the heart kung patuloy tayo nagpo-provide ng very vigorous activities. So take note, she is a PE teacher, so she does physical activities a lot. Okay? Pero yun nga, wala naman siya nararamdaman. So when I advised the patient about this, syempre, she was shocked. Kasi syempre, wala siya nararamdaman at all. No symptoms, no hypertension, no dyslipidemia. Hindi naman siya diabetic, hindi naman siya obese. Normal built naman ang BMI niya. So she was quite upfront, okay, healthy. So I advised naman with the patient and reassured naman, yes ma'am, you're healthy. You're almost healthier than some of the younger individuals in the room, but at your age, kasi syempre, we want to provide better quality of life. And since we do annual physical examinations, kailangan natin ito i-weigh in yung mga possible scenarios that might happen, even worst case scenarios. So it's true you can still do your physical activities, but I would not restrict you to the point na wag kang mag-exercise. No. You can still do physical activities. You can do Zumba, but those type of Zumbas would be appropriate to your age. Anything that will provide heavy lifting, very vigorous activities like a highly intensive interval training is no longer in the equation. Okay, wag na natin include for the meantime or for now, especially we're monitoring a cardiac finding on ECG, kasi we'll still monitor it after a month or even conduct some further studies. BP niya kasi actually is was initially high, but eventually nung second follow-up was normal. So we still suspect pa rin pre-hypertension. So pinaka-monitor ko pa yan. So it's important that we take things safely, especially kapag ganon, kasi ayaw natin magkaroon ng driver shock to any serious cardiac events in the future. Kasi as you grow old, your body doesn't go younger. Your body will experience age pa rin. So aging heart can also be presented with arrhythmias, AV blocks, ganon. So, we don't want to aggravate the circumstances na pwedeng magkaroon ka in the future. So, you can still do brisk walking, treadmills, especially at the pace that you can master, kung kaya. Pero as much as possible, take care of your heart. Yun yung habol ko sa kanya. And she quickly understood naman why I want to be on the safe side on her condition. Kasi ayaw natin itong magkaroon ng any untoward incidents. Kasi syempre, it's an annual exam. And the value there is, if you want to have a better quality of life, to provide more meaningful events in the future, like spending time with your apo, you don't over exaggerate things or activities, especially when you grow older. Try to ease down on the vigorous activities kasi minsan na-enjoy natin na, let's say, an old individual who is fond of tennis. So when he or she grows old, though wala pa siya nararamdaman, eventually she will or he will feel joint pains because of the heavy impact sport of tennis. So I would try to adapt the patient to from a singles tennis, mag-doubles na lang siya para hindi siya masyadong malayo yung tinatakbo niya, which is more convenient, still playing tennis. Or switch to pickleball, di ba? Which is trending ngayon. Diba? Mga ganong sitwasyon. We don't restrict the patient from, wag kang mag-exercise. There are still other forms of exercise and physical activity na pwede niyang gawin. Basta it will be safer for her age, for her situation. Now, I'll try to follow up with the patient kung ano ba yung further workups sa heart niya. We will collaborate also, planning to collaborate with a cardiologist in the future, especially if my repeat ECG na tayo at consistent pa rin yung second degree AV block niya. And eventually, if there is any changes, multidisciplinary care will always be entertained. Kumbaga, as a family doctor, we help patients navigate towards healthcare and counsel them kung ano yung mas appropriate na management for them. Diba? Oh, may pusa. Eventually, yun lang naman ang habol ko for this sharing session. Your aging body may need some time to also adapt with something new. Learning something that you already learned that is more appropriate to your age. Okay? Again, if you feel that this video is helpful and nakatulong din ma-process yung mga thoughts nyo, please leave a like, share. Also, please subscribe to the channel. We have it on Facebook, YouTube, TikTok, and hopefully, tuloy-tuloy to. Again, this is Dr. Chris, your online family doctor, making medicine easy for you to have a healthy life.